The rising number of cases reported involving violence against women and children, coupled up with a lack of safe houses or centres to take care of such victims, has left many of those affected at the mercy of well-wishers. The COVID-19 situation also forcing some children's homes to slow down on admitting new children into their institutions. And as Raquel Muigai reports, there are those that have taken it upon themselves to bridge that gap. But while one person can do as much, a majority of such victims remain helpless.
Her playful nature hides whatever misery and torture that was her life 3 months ago. At only 8 years of age, Asha Bitok, not her real name, unfortunately and unintentionally served to fulfill her father's sexual appetite.
The girl cannot tell how many times. She only says, Daddy waits for the night to come, and then he comes, does this and that.
Gladys Wanjiru says that the sexual abuse went on for months before it came to light, and even when it did, nothing was done about it.
One of the ladies is the one who gained the courage, and she told us that this girl came to me and she complained she's having pains on her front, her private parts, front and back. And the neighbor checked and she found that she's not okay. But the neighbor didn't know what to do, so she just left it at that.
As expected, Gladys reported the case to a nearby police station before having the girl undergo a physical examination to ascertain her status. Given that her father was now under police custody and the mother's whereabouts unknown, the Children's Department was the next stop. However, the help Gladys hoped for was quickly declined.
I'm in communication with the Children's Office, and what they told me is that the government is cutting down on children's home admission. And the reason they gave me is two. Number one is because the kids become very institutionalized. So that is why they don't want to take them to a children's home. And then they say when it is time that this child has now grown and they want to reintegrate them back to the society, it becomes very difficult.
Gladys was now forced to take in the girl, together with her 2 sisters, lest they turn to the streets. That was in March this year, just when Kenya reported her first case of COVID-19. A situation that paints a grim picture of just how prepared the country is in ensuring victims of violence and abuse are protected to the end as they await justice to be served.
And the 1195 number that is housed at the Ministry of Gender, also sometimes when they receive calls, they don't know where to place these survivors. Because if I'm a child and it's my father who's violating me, I need to be removed from that space first, before anything else happens.
According to Equality Now, there is only one government-run safe house or centre in the country. It is located in Makueni County. The other 46 counties rely solely on non-governmental run safe houses to cater to the needs of such victims.
Kisumu, for example, has 3 constructed ones, supported by different organizations to build it up and the county government. But it has not been equipped, so it is almost like a shell that is not useful to survivors. Most of the shelters that we have are run by NGOs, non-governmental organizations, who rely on donor funding, which means that if money runs out, then they might be forced to close.
While the Ministry of Health has raised concerns over the rising number of cases of violence and abuse among children and women, questions arise as to how effective such victims are protected, especially after their ordeals. For now, Gladys says she will take care of the 3 girls until when the Children's Department instructs otherwise. While these young girls have found a safe place, it is not the case for a majority of such victims, as they have been forced to perhaps live under the same roof with their perpetrators, or worse off, drown their stories in silence. Raquel Muigai, Citizen TV, Nairobi.